This video's aim is to help if you are suffering with a hamstring strain. Anatomy of the hamstrings. 3 muscles: semimembranosus, semitendinosus, biceps femoris. They work to bend the knee and extend the hip joint. A strain is damage to a muscle which can be microtears, which is classified as grade 1. It can be grade 2, which is anything from a minor tear to a major tear, but not a complete rupture. Finally, grade 3 is a complete rupture. When you injure the hamstring, you normally need to be placing strain onto the muscle, and it usually causes a sharp pain in the muscle itself. Stretch and contraction of the muscle are painful afterwards. It can be difficult to walk. Some bruising can occur. It will feel tight and can feel warm to touch. Throbbing is common initially. There are many reasons why you can strain the hamstrings. It may come on over time through lack of recovery, but it will still usually go in a one-off movement. Predisposing factors include overtraining without enough recovery, lack of flexibility, weakness, and poor muscular endurance. Sometimes a hamstring can be misdiagnosed, and a common issue is that it could be sciatica. Due to the complex nature of this area, you should have it diagnosed by your GP or physiotherapist, especially as you may have a back problem and/or sciatica. A scan is rarely required, as it can be easily diagnosed by a physiotherapist. How can you help yourself? Try some guidelines. Protect the area with a support. Rest, i.e. don't continue to play sport on it. Consider the use of crutches if too painful to walk. Ice the muscle. Apply ice for no longer than 15 minutes at a time, and always wrap the ice in a towel to avoid damage to the skin. Compression of the area will help to limit swelling, but this should not stop blood flow. Tubi grip can help. Elevate the whole leg to help limit swelling. Movement. Keep moving to avoid stiffening up, but don't irritate the area. After 48 to 72 hours, you need to gradually get your mobility back. A physiotherapist can guide you through these exercises and can help to put a tailored exercise program together for you. The aim is to stretch the hamstrings to aid healing and to minimize healing of a tight scar within the muscle. Hamstring stretch. Lie on your back, lift your right leg up off the ground, keeping your knee straight. Now reach and hold your leg with both hands and pull it up as far as you can while maintaining a straight knee. Hold for 30 seconds, then repeat with the left leg if needed. If you can't reach with your hands, use a towel and loop it behind the back of the leg. Repeat 3 times a day. It is also worth stretching the calf, as this too can get tight. Calf stretch, gastrocnemius. To stretch the right leg, take a long stride forwards with your left leg. Keep both of your feet pointing forwards, now while keeping your back knee straight and your back heel in contact with the floor. Start to bend your front knee and lean your body forwards until you feel a stretch in your back leg's calf. Hold for 30 seconds and then repeat for the other leg if needed. Repeat 3 times a day. If you get worsening symptoms or are unsure, then initially reduce the push into discomfort, and if this isn't enough, then stop altogether and consult your physiotherapist. After several days, you should hopefully notice increased flexibility and possibly reduced pain generally. When things are improving, you can start some light strengthening exercises. You should always be pain-free during these exercises and should start with your body weight only. Hamstring curl in line. While lying on your front, slowly lift one foot off the ground by bending your knee and bring your heel up as close to your bottom as possible. Now slowly lower back to the start position, repeat 15 times and swap to the other leg if required. Hamstring curl in standing. While standing on one leg, slowly lift your other foot off the ground by bending your knee and bring your heel up as close to your bottom as possible. Now slowly lower back to the start position, repeat 15 times and swap to the other leg if required. Theraband hamstring curls in line. Tie one end of a theraband to a fixed object and loop the other end around your ankle. While lying down on your front, slowly lift one foot off the ground by bending your knee and bring your heel up as close to your bottom as possible. Now slowly lower back to the start position, repeat 15 times and swap to the other leg if required. Squats. From a standing position with your feet between hip and shoulder width apart, slowly lower your body while keeping your chest up and sticking out your bottom until your knees reach 90 degrees. Make sure that your knees don't go past the front of your toes at any point. Your lower back should be slightly arched and your heels should stay in contact with the floor at all times. When you reach a seated position, reverse direction by straightening your legs and return to the start position. This is 1 rep, repeat 15 times. Lunges. Take a long stride forward with your right leg and raise your left heel so that your left foot is on its toes. Keeping your shoulders back and your chin up, slowly lower your body by bending your knees and hip, continuing your descent until your left knee is almost in contact with the floor. Make sure that your right knee does not go past the front of your toes. Reverse direction by forcibly extending the right hip and knee until you return to the start position. After performing 15 reps, repeat the process on your left. Stiff-legged deadlifts. From standing, bend at the waist while keeping your knees just unlocked and keeping your back straight. Once you reach a stretch in the hamstrings, steadily return back up to the full upright position. Keep the weight close to your body throughout, repeat 15 times. These exercises are early rehab and you need to progress beyond these as you are able. The first advancement would be to add resistance gradually, then progressing to plyometrics and then drill-based exercises. Remember, injuries take time to recover. The average muscle injury takes 2 to 6 weeks to fully heal on average, so be patient, there are no miracle cures. Physiotherapists are trained to treat hamstring strains. They use evidence-based techniques such as massage, ultrasound, acupuncture and an exercise program which can help to settle symptoms and aid the healing process.